On behalf of the management, it's my great pleasure and privilege to introduce our resource person, eminent personality, Dr. Sridhar Muthuswamy, Associate Professor, Department of Biochemistry, Karpagam Academy of Higher Education, Deemed University, Coimbatore, for 11 days FD program on prospects and retrospects in life science. DPT Star Scheme sponsored, organized by the Department of Biochemistry, Ratnavel Subramaniam College of Arts and Science. Scheme sponsored, organized by the Department of Biochemistry, Ratnavel Subramaniam College of Arts and Science, for delivering the topic Basic Components of Research Project Proposal. First, I was really surprised when I saw his profile. Sir profile is a lengthy profile, so I wanted to share the very short profile in this introduction. So he did UG PG Biochemistry at University of Chennai. His MPhil in Endocrinology, University of Madras, Chennai in 2011. His postdoctoral research associate in radiation oncology, College of Medicine, Chungbuk National University, South Korea from 2011 to 2014. He has completed SET in 2016, conducted by Mother Teresa University. And he has received various funding projects, especially he is a position in scientist mentor and principal investigator in various projects. He is currently handling the DST sponsored project entitled Crosstalk between insulin resistance and CRH may influence urocortin and alter bone cell function. He is the principal investigator for evaluating the role of non-aromatizable androgen on the expression of PC3 cells. He has published 27 research papers in SCI journal in various national and international reputed. He is the reviewer for various journals, various national and international journals, especially the very famous scientific reports Nature. And he is the editorial board member of Current Protein and Peptide Science, Frontiers in Oncology, Frontiers in Cell and Developmental Biology, Protein and Peptide Letters at PLOS1, the Web of Science Index. He is a life member of Society for Reproduction Biology and Compare Endocrinology, life member in India Society for Bone and Mineral Research, member for Indian Association for Cancer Research, member of Question Paper Scrutiny Board for Biochemistry, Periyar University, Salem, member of the Board of Studies in Endocrinology, University of Madras from the 2020 to the forthcoming 2023. He is the chairperson for the Institutional Animal Ethical Committee, Karpagam Academy of Higher Education, Coimbatore. He has organized as a program coordinator in various conferences, seminars, workshops, and symposium. Once again, on behalf of the Department of Biochemistry, Ratnavel Subramaniam College of Arts and Science, I warmly welcome you, sir, for this DPT Star Scheme sponsored 7 days FDP program. We are waiting for your eminent lecture, sir. Thank you. Now I have to hand over the session to our resource person, Dr. Sridhar, sir. Thank you.
Yeah, Sridhar, sir. You can take up.
Thank you, madam.
Yes, sir. You can take up the session.
Yes,
So
madam. I hope I'm audible.
Yeah, you're audible, sir. Shall I start presenting for you? Your
Yes,
PPT?
madam. Yes,
it's in my laptop. I'll do it for you. Yes, sir. So participants kindly.
So participants kindly.
Okay. Let me start this session by thanking the head Department of Biochemistry, RVS College, for giving the opportunity to share some of my inputs on how to prepare the research proposal and basically how to understand the methodology of preparations. I also take this opportunity to thank the VRSC and Dr. Uh, Shiva Ganesh for giving the insights about my CV. Basically, today's session is intended to cover some of the aspects of research proposal for which many of us are already acquainted to. It is just kind of an eye opener to ensure are we following these steps or are we skipping some of the crucial points. That is where we are lagging the scoring pattern, and that is the reason. Probably it could be the reasons for the rejection of project grants. I hope many persons would not understand the reasons for the rejection of the project proposals. So to that end, the Indian Council for Medical Research has organized a workshop on the project scrutiny of proposals, for which along with a professor from Christian Medical College, Vellore, we attended that way back in 2018. The salient features of those informations, I thought it would be pertinent to discuss among the faculty members. I hope this would benefit at least couple of faculties to prepare their research proposal in a better way. So with this, I think I am starting the session. Can we go to the next slide, madam? The entire talk of mine would be covered in the 7 aspects, and this is basically the anatomy. Once we are done with the proposal, we need to ensure that did we cover all these 7 important components of the anatomy. The first one is, did we define the problem that we are planning to investigate in the proposed project? The second one is, how did we specify the objective? Is the objective clear or unclear? And how to make an objective? The third one is, did I select the correct model system, or is my design is appropriate for the study in which I proposed the research? And what is the study population that I have selected? Did I choose the correct sample size? Is it too big or too low? And how do I analyze the data? And what are the conclusions that I'm going to derive out of it? So my talk would be covering all these 7 components. Next. Next. Yes. So as I told you that initially when we submit the project proposal for scrutiny, there will be something called as desk rejection. So this desk rejection is based upon something called as PICOT analysis, PICOT analysis. Madam, can I go to the previous slide? Yeah. So the first and the foremost thing is that did I define the problem correctly? That means the topic should be conveying the entire project proposal. So there are certain crucial components that are very, very essential for conveying the intended meaning. Number 1 is the population. Number 2 is the intervention. Number 3 is the comparison. Number 4 is the outcome. The last one is the time frame, which is optional. That is why it can be called as a PICO analysis or PICOT analysis. So basically, we need to ensure, did I use the correct population in my study and whether it is conveyed in the title? Did I use, what is the intervention that I'm going to use? Did I mention it in the title? That should be there. What is the comparison that I'm going to do in the current proposal that I am using? That should be there. What is the clinical outcome or the research outcome that is going to come out of the proposed project? That should be mentioned. And the last one is, what is the time frame that is required for the execution of the experiment? So essentially, this 4 components or 4 to 5 components, PICO or PICOT analysis, is very, very crucial in order to convince the person who are doing initial scrutiny. So once your proposal crosses this initial scrutiny, then it will be a little easier for you to impress the reviewers. So when it comes to defining the problem, how do we define the problem? What are the things that we use? As I told you that we need to define the problem very simply. Say, for example, it could be a diabetes-based research, or it could be the cancer-based research, or some kind of a cardiotoxicity, hypertension research, or it could be some plant oriented or environmental oriented. So any problem, what we are intending to define, what is already known, what is the definition that is given by the statutory bodies. For example, if I'm going to talk about the diabetes mellitus, I have to talk about how did diabetes was defined by Indian Council of Medical Research and WHO, World Health Organization. If I am going to talk about some kind of a crop productivity research, what is the, I need to explain in terms of ICAR guidelines. So one needs to just refer the guidelines of the national funding agencies that has been constantly been revamped, and then it has been time to time. If you could go and visit the website, they'll give updates on the statutory guidelines, on the definition, on the state of the art techniques, how far the research is going nationally would be there in the guidelines also. So please refer to the guidelines when you are going to define the definition of a problem. So when it comes to the definition of the problem, so I just wanted to be an interactive session. If somebody is feeling to have a question, I guess the convener would permit to stop in between and then ask question. Am I right, madam?
Yes, sir.
Yes. Let this not be a monotonous session or one talking and another is just listening or putting it on hold or like that. So let us discuss about it. And if you have any problem, if you feel that I'm going a little faster also, you can please let me know. So I told you about the psychoanalysis for the research title. For the objective also, they'll be looking for this psychoanalysis they'll do. So they take an objective hypothesis and then check whether the individual or the principal investigator has talked about the population, intervention, comparison, and outcome. These four are crucial components of the objective as well as the title. Next slide, madam. So this is what, when we talk about the research questions that we are going to frame, the objectives needs to be feasible. Say, for example, if I am going to make a contention that my objective is to develop a vaccine for COVID, the first point that would come in mind is it feasible to execute? That means, do I have the biosafety cabinets in what is the level of safety, and am I competent to handle these things? Do I have authorized labs to execute that? So that needs to be first checked. So these are the essential characteristic features that one has to take into account when you frame a research question or objective. The first and foremost is feasible. The second thing is we need to make it as interesting as it could be, keeping in mind it should be realistic also. The third important point is what's the novelty that I'm going to bring in my objective, or what's the different kind of strategy that I'm going to form. And the fourth important point is the study ethically approved or not approved, and what's the relevance or why this funding should be approved. So these are the 5 essential characteristic features of the research question. Now we need to ensure that I cover all these 5 aspects comprehensively, so that I'm convinced that my proposal is worth giving it a try, and it is crossing the initial scrutiny as well as the preliminary round of scrutiny when the research question is also been done. So for which this 5 is very, very important. And when it comes to, as we all know, when I have some objectives, in order to prove my objective, I'll be framing some kind of an hypothesis. So it is very, very important to have 2 hypotheses parallelly, what we call as the strategy and alternative strategy. Say, for example, if I am saying that I'm going to use the efficacy of a certain plant and how it is going to improve the diabetes mellitus or some other disease condition, I need to foresee the other way also. In case, what if this plant extract is going to cause the increase in the glycemic level? At that condition, is it capable of increasing the blood glucose level in hypoglycemic individuals? That can be the alternative strategy too. Supposing if I'm going to find a drug for the snake venom, I hope everybody knows that snake venom causes the blood coagulation. Therefore, whatever drug that we are going to give is expected to have a thrombolytic activity. In case if it is not having thrombolytic activity, on the other way, it is inducing the coagulation process. then that can be used for hemophilic individuals. That in that way, we need to form a question, and then we need to foresee the different possibilities of the results. What we are going to do if my objective is going to succeed, what if it is going to fail, what are the alternative strategies that I have my disposal. And that is something that we need to be very very sure. And if I say that it is going to succeed, if it is going to fail, how I am going to measure the objectives, what are the quantitative measures and qualitative measures that I am going to use in order to give some kind of a value to my hypothesis. So the measurable in terms of quantitative and qualitative measurement we need to do. And the hypothesis should always focused on the population. I was referring about the PICO analysis, where the population is very, very important. And time frame, I was talking about the time frame PICOT T1, and the relationship what we are examining, what are the variables that we are studying, and what kind of statistics that I use for the analysis purpose. So essentially, a research hypothesis should have all these components. So keeping this in mind, roughly a small example of hypothesis has been put in the next slide, which would be actually left to the audience to understand whether it is prepared in adherence with the PICO format or not in adherence with PICO format. Can we move to the next slide, madam?
Yes, sir.
Yes, madam. So this is an example that we took actually. For males over 40 suffering from chronic hypertension, 100 milligram of daily dose of this new drug is going to lower the diastolic pressure at an average of 10 mm of mercury. So this is the sample objective that has been given for us for evaluation purpose actually. Now I need to look into the PICO analysis and then check whether the hypothesis is framed in alignment with the PICO format. First point is the population, as I mentioned. So here the population is the individuals over 40 who are suffering from hypertension. That's the population. The second one is the intervention. Intervention is the medicine that we are going to use. So what is the intervention? The new drug that they are trying is the intervention. And C is the comparison. The comparison means they have to use another drug also, isn't it? So, so we need to find whether the comparison part is here or not here. For males over 40 suffering from chronic hypertension, the 100 mg of daily dose of this new drug is going to lower the blood pressure an average of 10 mm per mm mercury. So the comparison per se is not given in this hypothesis actually. However, compared to untreated level, this treatment is going to reduce the value by 10. Suppose if the individual is having 150 higher BP, then they can expect a reduction in 10 and they can expect of 140. So the comparison part is also there, but it is hidden. And what is the clinical outcome? Clinical outcome would be the reduction in the hypertension. What is the time frame? They have mentioned the time frame here. Okay, they did not mention the time frame. So the time frame is missing here. So therefore, technically, yes, madam.
Should I go for the next slide, sir? Or?
Yes, madam. Okay. So when it comes to going for a clinical study, what are the studies that are available, and for what the study needs to be used? So clinically, if we are going for a development of a diagnosis kit, I need to choose a study with cross-sectional analysis. If I am going to use a therapeutic component, I need to go for randomized controlled trial. If I am going to use a prognostic marker, I need to go for a cohort study, particularly prospective. And if it is to identify a specific cause of a disease, then I need to go for a cohort cross control. So if I need to do some kind of a description about a specific disease, I need to write about a case series or cross-sectional study. So technically, this is very, very difficult to understand or keep in mind. So therefore, what I thought always, if we take example of a movie, it will be very nice to keep in mind. So with that thought, the subsequent slides have been used. Some kind of a movies to understand a different model system used for clinical studies. So next slide, madam. This is the level of increasing evidence that I'm talking about. The basic fundamental research is all about with the small animal system and also the cell-based system, followed by expert opinion, case series, case control study, cohort study, randomized cohort study, and systematic reviews and others. So when you go down the line, there will be increase in the evidence. Next slide, madam. Let us take an example of some kind of a movie. So if we are going to talk about some kind of a hit movie, that means we are going to talk about something which has already been a hit. So we are going to talk about the outcome of a research, that is the case report or case series. If I need to go back and then trace something out, I'll be talking about a case control. So if I need to get an overview about what is going to happen when I'm going to release this drug into a population, now I need to do a cross-sectional analysis and then take a sample across the section to have a cross-sectional view. And I need to look forward in order to make a cohort study. And in order to experiment and then find some result, I need to make a movie by myself. I need to produce or direct in order to do some kind of an experiment. That forms the last part. So these are the five kind of clinical scenarios that exist for us to easily remember. Sometimes when we look for some kind of a project, we are a little confused. Should I write the term cohort study or cross-sectional study or a case control or experimental study? So for that, I feel this will help. Next slide. So I'll be giving little details about this thing, the possible ways one. So we need to take some 10 hit movies at the box office. If I am going to describe them, how many of the 10 movies have that ABC? ABC, you can imagine as kind of a Rajinikanth movie or something like that. I'm going to take some kind of a 10 hit movies and then find out how many of these 10 has featured Rajinikanth in it. So that is called as, next madam. This is called as a case series. This is called as a case series. I take 10 and then out of 10, how many is going to be involve ABC? That becomes the case series. The second one, take 10 hit movies and then take 10 that are not hit also. Now I'm going to take in these 20, how many of it as ABC? So that falls around. Next, madam. This is called case control. So first one is case series, where I'm going to focus only on the hits, not on the other way. The second possibility is I'm going to take 10 which is hit, 10 which is not hit, and then try to see how many of it has got the ABC, that is case control. The third one, I'm going to take 10 movies running in the city and then look for how many of it has got ABC. Next, madam. This is called as a cross-sectional study. That means I did not do any experiment. I'm just making an observation and checking it. And the fourth one is I'm just taking 10 movies and then look forward how many is going to be hit. And that is called, we don't know, we are looking forward. So this becomes a prospective cohort control. Next slide, madam. And this is the experimentation part. Take 10 movies and you have to cast yourself the hit person like Rajinikanth, and then you take and then see how many of the movies. We have to direct or produce a movie by ourselves using some ABC as an individual and see the success out of it. That means we are making an experimentation by ourselves. This becomes an experimental part. Next, madam. So this is what is experimental studies. So put together, so if we are going to describe the hit movies alone, that becomes a case report. And if we are going to look back two things, which is hit, which is not hit, that becomes a case control. If we are going to take a snapshot or across a section of a population, then that becomes the cross-sectional thing. If you are going to look forward in order to see an effect of something, say for example, outbreak of COVID, and that becomes a cohort study. And if you are going to make yourself some kind of an experimentation and then try to analyze some kind of a result, then that becomes an experimental study. So if you are going to apply for ICMR, especially if it involves the clinical component, so when you are confused about choosing whether I should use the term case control, cross-sectional cohort, or experimental, you can just refer this. I have left the slide with the organizer of the conference. You can keep in touch with the convener in order if you want these slides. Next slide. Now coming to the different methods by which we can collect the data, and what is the veracity or what is the value of this kind of a data. Say, for example, if it comes to the clinical study, the first and foremost thing that what we do is kind of a survey that we are going to conduct. Say, for example, if a new drug is hitting the market, how many of you are feeling comfortable? What is your age? That kind of a questionnaire is must actually. The questionnaires will have the age with common criteria like age, gender, and if the individual is a female, whether married or unmarried, and marital status and menopause status, many things comes into picture. And after collecting the questionnaires and surveys, you can have some kind of a meeting and you can have some kind of a focus group in order to discuss about the outcome of a specific research and make your own observations, and then you can write as a review, and you can make some kind of a test and assessments, document reviews, and you can also go to the database and then take the data which is already published also. And these are some of the methods by which we can collect the data. Very similar to review writing, we can look for several databases and then take the information from the database. Next slide. When I talk about the description of a protocol, what are the components that should be there? And we need to mention several criteria, like as I told you that when I'm going to describe the protocol, it should mention the age, it should mention the sex of the subject, and what is the race, whether American, Caucasian, Indian, Asian, like that. And what is the diagnosis that we do, what is the diagnostic test requirements, what are the possible medications requirement, what are the signs and symptoms of the disease. All those things should be mentioned in the protocol that we are going to mention. Sometimes we often mistake the signs and symptoms. If an individual, if the doctor is able to make some kind of an observation without getting any input from the patient, then that forms the sign, and symptom is something that only patient experiences and then lets that out. Only if the patient says, then the symptom is known to the doctor. Otherwise, it is not known. So we need to ensure that all these components are included in the protocol that we have mentioned. So if some of these components are missing in the protocol, then likely they'll ask for the revision, or they may reject the proposal, citing the reason that your proposal did not cover the which age group you are going to address, or what is the sex that you are going to address, and all other things would be there. So we need to take into account when we write the protocol for a clinical study. We need to ensure that these components should be there. Next slide, madam. This is very, very interesting thing that sometimes when we go for some kind of a case study, so for example, there is some perception that a person who is consuming Ajinomoto for a longer time may have the increased propensity to develop a colorectal cancer. If it is a case study, then it is fine. So with one study, we can do it. For each and every study, we need to mention the sample size that we are going to use. And that sample size should not be too big, should not be too small also. So it needs to be calibrated according to the type of studies. So for the optimum size and for the statistics that we are going to use, we need to take into account what is the sample that we are going to do, what is the size of it is very, very important. We need to ensure that if it is an animal model, always it is preferred to use 10 animals per group. However, getting ethical clearance is very, very tough these days. So you can at least push for 6 animals in a group. In case if you are able to convince the ethical committee meeting, and if you are going to get 10, that's fine. Otherwise, please ensure that at least 6 animals are used if you are going to use experimental model system involving rat or mice or rabbits. If it is a clinical sample, I think you need to look into several counts like prevalence, and the inclusion criteria and exclusion criteria are very, very important. So when you are going to apply the inclusion criteria and the exclusion criteria, the sample number is always going to come down. So under these conditions, then we need to foresee the inclusion and exclusion criteria and arrive at a specific number. And the finalized number should be viable for statistical analysis. We need to please ensure that the sample that we use is actually viable for analysis and it supports the project to be funded by the statutory bodies such as ICMR and DST and DBT. Next slide, madam. I don't know whether it is appropriate, but then this is a slide that that has been used in Indian Council for Medical Research. Can we go to the previous slide itself, madam? Yeah. This is a slide that they use. Next slide, madam. Yes. To consult, the slide which says to consult. Previous one. Yeah. To consult a statistician after an experiment is finished is often merely to ask him to conduct a post-mortem examination. He can perhaps say what the experiment died of. So this was very little harsh when I say it actually. Most of the time this is what happened in kind of clinical studies that we do. That once we complete everything, then we go for a statistician. But actually the statistician opinion should be brought well prior to the designing of the experiment. And what is the post-hoc test that we are planning? What is the minimum number of sample size that it is required? So once you complete everything, and then if you go to a statistics individual, you can only say that whether your experiment is valid or not valid. So when it comes to the validity of the statistical methods, one needs to take care of two things. One, we call it as specificity, and the second one, we call it as sensitivity. Interestingly, the person who has written a well-known statistics book, I think he was around 85. I don't know, his name was Salvar, I think. So he was the person who was talking about the statistical analysis at the ICMR headquarters when I attended the meeting. He has thrown a question to me, like, gentlemen, please stand up. If you are given an experiment, and would you look for specificity or sensitivity? So I was just thinking then, I don't know what he's hinting at. I was just giving a random answer that I will look for specificity, and then somebody was pushing for sensitivity. And when the final discussion came into the picture, that he was saying that, supposing if we are looking for some kind of a disease outbreak, let us take COVID-19 as an example. I have developed a kit for COVID-19. So now let us keep in mind the two important factors called specificity and sensitivity. If it is going to determine the level of infection accurately only for COVID, not for any other thing, then it becomes a specific kit. How much smaller amount it is going to detect, whether it is going to detect the infection at the earlier stages or only in the latent stage, it is going to determine. And that becomes the sensitivity part of it. Now, having understood this, what is important? It is very important to ensure that the specificity component is always taken care of. Sensitivity, we can have as a second option. But however, the specificity of the statistical test or the experiments or the methodology that we use should be very, very specific, and it should address the hypothesis that we face. So let us focus on more on the specificity, and the sensitivity part can be given the second priority. That is what I wanted to convey here, that whenever we frame the statistical analysis or some other experimental part, let us pay attention more to the specificity part than the sensitivity part. Next slide. This is the fallacy of statistical significance. Next slide, madam. And sometimes the statistical significance can give us the wrong answers also. So at that time, we need to be very, very cautious about the statistical limitations that we use. Sometimes the statistical method may not be appropriate for a specific disease. So therefore, one needs to do a complete analysis of appropriate statistical methods that we are going to use. And we need to ensure whether those methods have already been approved to be used for some kind of a study that we are applying for. Next slide, madam. So this is the small thing that I want you to keep in. The first thing that we need to do an inspection of the data, and firstly we will be removing the error. So we look for error, and if there is error, we are going to make minor modification or appropriate modification, and then make a comparison whether this after error is minimized, how does it look like. And once I do that, after making an inspection and then removing the error and the comparison, I need to form a model through which this can be analyzed. And then we need to simulate some kind of a model situation to do a what if analysis before making a sound interpretation or conclusion. So we need to ensure that in the statistical analysis of some kind of a project proposal, we need to include these components in order to make this project a more meaningful one. Next slide. This is something similar. Sometimes, as many of us know, that there are two hypotheses that we will be framing. One we call it as null hypothesis. The second one we call it as alternative hypothesis. Very similar to that in the initial stages I was mentioning about having two more strategies. Similarly, when we go for statistics, we have null hypothesis and we also propose alternative hypothesis. And if we are going to misinterpret our statistical analysis, then that results in two kind of errors. One is called as a type 1 error. The second one is going to be a type 2 error. So because this is not going to have an elaborate interpretation of statistical methods, I'm just leaving it at this point. Just we need to ensure that we are making sure that there will not be a case for type 1 or type 2 error in the statistics that we perform. That is the point that I wanted you to, that's the point that I want to emphasize in this slide. Next thing. This is the crux of the matter actually. When the project is submitted or final program advisory committee is constituted, these are the components which are taken for giving the marks actually. I did not put the marks here because it also involves some kind of a confidentiality. The first and foremost thing is they give an opinion about the academic qualification of the individual. I was talking about the feasibility of the experiment. Feasibility does not only involve the laboratory equipments, it also has something to do with the competency of the PA also. So if we feel that we are not competent to do that assay fully, we can have someone as co-PA who can also contribute and supplement our ideas so that we ensure that the PA competency part is taken care of and the professional competency is taken care of. If this is taken care, then you get full marks in the first topic. And the second one, if the comments are made in PyCart analysis, then you get full marks on that. If it is not adhering to the objectives, then they will reject the proposal stating that the objectives are not according to the PyCart format. The third one is the scientific merit and technical merit. So when we are talking of the technical merit, if I am going to talk, say for example, I've isolated an enzyme from a substrate, from a microorganism or from the plant or some other thing or an animal source. If I'm going to do a Western blot analysis, then technically it is not a correct method to do a Western blot analysis because Western blot analysis is something to do with antigen-antibody interaction. However, the enzyme activity is best measured using appropriate substrate and going for a spectrophotometric method. And people used to say that when we use enzyme assay, it is something lesser, and when we go for Western blot, it is something higher. That's the wrong notion or wrong perception that is sporadic in some of the research population. And we need to ensure that for all enzymatic assays, or if the protein is an enzyme, better not to go for a Western blot analysis and then use the enzyme assays. And the methodology part and work plan, whether it is adhering. Most important point, whether we have given too much of budget or too little budget to carry out. And that is something that we need to take care. And sometimes you get a minor revision on the budget also. But this is something very, very minor. It can be revised. And overall, what is the general comment on the suitability of the applicant? So when you are going to make a tick any 4 out of this, then most likely you will get your project recommended by the reviewer. If not, it will not be recommended. So this carries each 10 marks, and then when the final recommendation on a 10-point scale, they'll ask. So if you are going to score more than 5, your project proposal would be accepted. Otherwise, it will not be accepted. This is not as per ICMR format. This is as per DSC format. Next slide. And so with this, I'm done with the clinical part of it. Because it is a faculty developmental program, I thought that many of the persons are working with the phytopharmaceutical. I can spare some 2 or 3 slides for them to enlighten what are the current guidelines that are available to apply for the Department of Biotechnology project under the phytopharmacological scheme. If the convener permits, then I can proceed and complete that 4 slides. Otherwise, let me put a leg over here.
Sir, it's okay. We can continue now.
Yes, madam. Thank you, madam.
Because phytopharmaceutical will be common to all the life science and biological aspects.
That's what I thought that what are the common errors that we...
Yes, sir.
Yes, madam. That's what I thought it would be pertinent for me to talk about the phytopharmaceutical drug. There are a number of calls in currently in Department of Biotechnology under this particular scheme, phytopharmaceutical scheme. So when we go for a phytopharmaceutical scheme, the first and foremost thing that is that we need to ensure is the traditional knowledge of the herb. At that point, we need to make a big take. Why did I choose a drug? Just because the drug is freely available, one cannot take it. What is the traditional knowledge that has been currently available? Is there some scientific validation that is currently available? If the scientific knowledge is validation is lagging, and if it is already mentioned in some kind of traditional knowledge, then your proposal is most likely to be funded. Okay, and that means if I'm going to use, say for example, let me take one example of I take some herb and then give to a rat, and I report that it is going to reduce the blood glucose level. After, say for example, 2 or 3 months, if somebody else is going to make a report that it is not having any effect on the glycemic control of the rat, then all our experiment, all our energy that is being invested will become waste. Now the question comes, the corresponding author would be asked by the editor to give an explanation about the results. The standard reply that we get as an editor is the plant is collected from a different region, the plant is collected from different seasons, the plant is harvested at multiple time points, and there is a slight difference in the genus or something like that or species. The Department of Biotechnology is not advising these things. So how we can correct this? So there is something called as standardization. I hope everybody is making a note of this crucial note. This is called as standardization of the herbs that we are going to use. Please include the standardization part in your first objective. So if you are going to use this as your first objective, your DBT proposal is halfway through. So if you are going to ensure that my plant, I'm going to do some kind of a standardization. What are the methods by which I can do a standardization? It could be a qualitative analysis and quantitative analysis or both, preferably both. So I need to do a qualitative analysis of what are the components, and I need to do what are the contents that are present in it. This can be accomplished by thin layer chromatography or HPTLC or GCMS. And I need to make a copy of it. This is called as fingerprinting. So if you are going to give a fingerprinting as a standardization procedure, most likely your project will be approved. So please ensure that the extract that you use is being a standard extract. Use the term standard in the topic itself. Standardized extract of so and so is evaluating the effect of standardized extract on diabetic rats or some other hypertension like that. So please use the term standardization. So when you are going to use the standardization, there are a number of agencies which give statutory guidelines in order to make the phytopharmaceutical. Among that, CDSCO is the most competent authority. Can we go to the next slide, madam? Let us talk about how do they define the phytopharmaceutical. So suppose if you are going to use the term phytopharmaceutical, that means each fraction or the fraction that you are going to analyze should have at least 4 components in it. So how do we say that there are 4 components in it? Either you can do a TLC and then show that there are 4 components, or you do some kind of a bioassay guided activity and show there are some bioactive components that are present in it. So do some kind of a qualitative analysis to show the presence of flavonoid, terpene, alkaloid, or some vitamins, or you do a fingerprinting of using chromatographic analysis such as HPLC to show that each fraction is composed of 4 components. That is something that is very, very important. If you ensure that you are showing this 4 components in the fraction and you are going to do a bioassay, most likely your project would be approved. So please ensure that you are, once if you limit from 4 to 1, all of you please note, if you are going to limit from 4 to 1, then if you are going to use only one, isolate one compound and I'm going to develop a drug out of it, it will not come under the phytopharmaceutical drug. It will fall under allopathic drug. So if you are going to limit it as one molecule, then it belongs to the allopathic drug. If it is having 4 ingredients in the phytopharmaceutical fraction, and that becomes a phytopharmaceutical drug. Next slide. These are some of the examples that I was referring, that we should have a traditional knowledge, and we should know the geographical location of it. What are the uses that has been documented in the traditional knowledge? So once we know that, and then if there is no scientific validation, then it becomes a very good candidate for the project proposal. Next. These are some of the regulations that is given by CDSCO on the applications related to phytopharmaceutical drugs. Next slide. This is with reference to drug control of India, and what are the current manufacturing, good manufacturing practices, and what are the factors that we need to collect. The information should have from where you are collecting the herbs, how do you cultivate, and how do you process the sample, and how do you formulate. All those things that should be given before you write a draft on it. Next. Next, madam. Yes, this is for clinical trials. Next. This is the fees for the drugs, for phytopharmaceutical drugs. Next. Next slide, madam. Again, these are all fees. I hope I'm done with the things. So I'm going to open this up and then look for more questions than taking your time for a long time. So with this, I think I'm stopping now, and I would like to take up a few questions.
The session is open for questions. You can just post your queries in the chat box.
If there is no question, there are 2 ways by which we can interpret. One, it is
Sir, you
completely
can
understood.
post your email ID also. Okay, like they can have an interaction with you.
Thank you so much, madam.
Yes.
The feedback, I am ready to answer the questions if it is mailed to me also. Can I take 1 minute?
Sir? Yes, sir. Yes, sir.
Yes, yes. I'd like to personally thank my mentor, Dr. Devagi madam, who is here. Actually, at the beginning itself, I noticed the presence of madam. I take this opportunity for her to.
Madam is connected with us. Devaki ma'am
yes.
is there with us.
Yes,
Yeah.
yes. I'm very fortunate to have her in the session.
Is there any score for the institution? Devaki ma'am has posted you a query. Like, is there any score for the institution?
According to ICMR, there are scoring for institution. For example, does the institution have a Department of Scientific and Industrial Research recognition, DSIR? And does the institution has the Institutional Biosafety Committee? institution score is there. Does the institution has A grade? All those things is there. Out of 10, on a 10-point scale, they are categorizing institutions into different scales. Certainly, the IITs and central universities they'll score 9, and there are certain institutions which score less much. On record, I can confirm that the marking system or grading system is there according to institution for ICMR. It is there. But some institutions, they say that, like DST, there is no institutional ranking. For ICMR, certainly institutional ranking is taken into account.
Sir, we have many appreciation messages appreciating your talk and your presentation, sir. So it was a very highly informative session for us. And sir, I have a query for you. So when we go for joint ventures with different institutions, for example, if I take RVS should collaborate with another institution,
yes,
and how weightage should the proposal should be, sir?
And it should be supplementary. So what is your area? There are a number of ways it can be accomplished. Number one, a joint PA system. So you can be a PA of your objective, and the other institution person can be the principal investigator of their objectives. You can have different budget. So whatever budget that you are going to receive, you are going to address a specific objective, and you have competency in that area. The other person to whom from IIT or IIM or other state university that you are collaborating, if they have a competency in that proposed thing, they can give a separate budget. So that what you do, invariably you acquire that knowledge in this joint project, and next time when you apply, you already gained this exposure, and then you can apply on your own. You need not rely on the joint proposal. That's a good initiative that the government of India has taken now.
Yes, sir. So participants, like if any other queries, you can also pin to sir's email ID. Sir, could you please share your email ID in the chat box?
Sure,
possible?
Sure, ma'am.
So looking at his profile, we have, I'll share the profile also in the WhatsApp group. You can look into his profile, lot of proposals that he has submitted and many DPT projects he have. And currently he is guiding a lot of, sir, PhD students are 5, right?
3, madam.
3. Yes, sir.
Yes.
So your specialization is from cancer biology, right?
Yes, ma'am. Endocrinology, madam.
Endocrinology. So, sir, email ID is being flashed in the chat box. We can just take a note of it. And if there are any queries or anything regarding the session or regarding the proposals and the joint proposals also, you can ask him any sort of doubts. So now I hand over the session to Ravi Arasina.
Thank you, sir. Thank you so much for sharing your knowledge with us. I heartily welcome Ms. Mary Joy, Assistant Professor, Department of Biochemistry, to give a vote of thanks. I welcome you, ma'am.
I, on behalf of my department and management, first of all spread my most sincere thanks to the Lord God. I want to thank our guest speaker, Dr. Sridhar Muthuswamy, who gave us vital time and effort that you took to share your thoughts and experience with us, sir. It's been a great section with you, sir. Your sessions were witty and very informative. Your presentation drawn us like this was never a dull moment. After listening to your speech, we got to know something about project tools. Thank you for your enlightening speech, sir. I want to extend my generous thanks to the management, Principal Dr. T. Sivakumar, DPT Star College Coordinator Dr. Dadabalan, and our HOD ma'am, Mrs. S. Samina, and our department faculty members for their support and encouragement. I also express my heartfelt thanks to the heads of various departments and faculty of their faculty for their valuable contribution for making this session great success. Once again, I thank you all. Thank you.
Thank you, Ma. So, Sridhar sir.
Thank you very much, madam. Should I take a leave?
Yes, sir. Thank you so much for your wonderful
you, madam.
presentation. So,
Thank you, madam.
participants, the feedback link has been posted. I'll repost it again for you. So you can fill it and you can join us the session by tomorrow morning, 11 a.m. again in the fourth day. So thank you.